check it, talk to doctor and share it. Gonna get it, gonna slip it, gonna cuff it, check it, talk to doctor and share it.
Get it, slip it, cuff it, check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
Did you know that heart disease is the #1 killer of women? I didn't, until it happened to me.
All women need to know that cardiovascular disease is the #1 killer of women. Know your family history and talk to your doctor about heart disease.
Awareness may make the difference between life and death.
Welcome to Beauty Superstars Talk, your backstage pass to experts in beauty. My name is Mickey Wright, and each and every week I have the privilege to interview Black beauty bosses who are doing amazing things in the beauty industry. We give voice to their stories and celebrate their excellence while they drop nuggets to help all of us become better beauty pros and better entrepreneurs. More than a podcast, this is a movement to encourage Black excellence, entrepreneurship, to preserve our history, and to bring healing to the beauty industry. Welcome to Beauty Superstars Talk, your backstage pass to experts in beauty. My name is Mickey Wright, and each and every week I have the privilege to interview Black beauty bosses who are doing amazing things in the beauty industry. We give voice to their stories and celebrate their excellence while they drop nuggets to help all of us become better beauty pros and better entrepreneurs. More than a podcast, this is a movement to encourage Black excellence, entrepreneurship, to preserve our history, and to bring healing to the beauty industry. Hello. This is Mickey Wright with BeautySuperstars.com, and I want to welcome you to Beauty Superstars Talk, your backstage pass to experts in beauty. So thank you so much for joining us. And when you mention beauty, it's hard not to think of health and beauty. For many of us, we can sometimes take both for granted until they may start to change. But today we're here to talk about your most valuable asset. You may be saying, I don't have any stocks or bonds or other assets, but you may think about maybe my house is my most valuable asset. But no, your most valuable asset is you and your ability to provide for your family, which is really your health. The recent pandemic really helped shine a light on one of the biggest challenges we face in the U.S., which is the health gap, and it's between African Americans and Hispanics and the general population. Whether it's finding quality health care, preventing or treating diseases that run rampant through the Black community, such as diabetes, heart disease, cancer, or accessing affordable options for health care, insurance, and prescriptions, we really need an ally. And today we are blessed to be able to speak with an expert in asset protection for you and your family. And she is healthcare advocate Sandra Miller-Jones, and she is passionate about providing solutions. She's also an insurance expert whose company specializes in affordable healthcare insurance, Medicare, and final expense insurance. And so before I formally welcome her, I want to share her bio and then we'll jump right in. So Sandra Miller-Jones is a longtime entrepreneur whose passion and corporate mission is to help improve the health of African American and Hispanic communities nationwide. After graduating cum laude from Howard University, Mrs. Jones went on to become one of the first African Americans to receive an MBA from Northwestern University's top 10 Kellogg School of Management, and then the first female African American marketing executive for the Quaker Oats Company. Mrs. Jones left Quaker Oats in 1978 Mrs. Jones left Quaker Oats in 1978 to establish SMSI, a national marketing services company that now has outreach teams in 35 major U.S. markets, operating under the banner of SMSI Healthy Living Solutions. SMSI's client list includes Procter & Gamble, Blue Cross and Blue Shield, Quaker Oats, Humana, AARP, General Mills, and many other national brands and organizations. Mrs. Jones is married to her business partner, Lafayette Jones, and the couple have one daughter, Dr. Bridget Jones Brooks, an orthodontist who lives in Atlanta with her husband, Patrick Brooks, and their son, Easton. And so I want to welcome you, Sandy. How are you?
I'm wonderful. Thank you so much for having me, Mickey.
Yeah.
Such a privilege to be with you.
Oh, well, thank you so much. I feel honored. So, you have a passion for this, for taking care of our health. And um, what is it that got you started, on this path?
I have been a volunteer in the community since I was a teenager, because my parents were volunteers in the community, trying to identify ways that we could help other folks. And one of the things that was consistent throughout this time was that there were so many people who were suffering in our communities, and have been for so long, with health issues. In my own family, my father had diabetes, my mother had heart disease. And so I've known the need for us to be able to do some things in that arena for many, many years. So since my business, which we started over 40 years ago, did do some things to try to address the health issue. In recent years, in the last 10 years, I suspect, we've continued to focus much more heavily on ways that we could contribute to reducing those health disparities.
Yeah, that's pretty incredible that you have a business that's 40 years old. So tell us about SMSI, what it does, and what it offers for the community.
Well, we are really a national organization. We've got local managers in the top 35 markets based on African American and Hispanic population. And our teams generally go out into the community and help educate folks about health issues primarily, but sometimes other things as well. And we have over the years distributed millions of free product samples through our networks that we've developed. Our networks of community partners include more than 10,000 African American and Hispanic churches. And the beauty industry has been just so remarkable, so wonderful to us throughout the years. We've been working with as many as 40,000 salon owners and operators throughout the years to reach their clients with free product samples, as well as the important information that we've been able to distribute.
Yeah. Well, that is incredible, first of all. So yes, we want to commend you and your husband for, all of the efforts that you've done and all of the relationships that you've established. And it really is, I think, a fabulous way to make an impact. My background is as a hair designer, and we have a captive audience. Those of us in the beauty industry, it's like we sit with, someone kind of one-on-one for, an hour, maybe a couple hours, or maybe a little more, depending on the services. And, it's like many of the people that we see may face some of these, health challenges, and so why do you feel like it's important for all of us to have health insurance, and for us to maybe have more of these conversations?
Yes, before we go to that question, let me just say that Lafayette Jones, who is my husband and business partner, was instrumental in bringing the beauty industry and helping to build that network, because he's worked for many, many years in the beauty industry, and he has built relationships that have enabled us to start to form these partnerships. And so we have to say a special thanks to Lafayette for that.
Yeah.
But we talk about the reasons for people to have health insurance, especially right now. There are, as we know, and as I've already said, these health disparities between African Americans and white citizens have been in place for many, many years.
Yes.
But people are just beginning to realize it and to acknowledge it. One of the most well-respected research organizations in the healthcare industry is the Kaiser Family Foundation. So the Kaiser Family Foundation just did a study just this year that they concluded, after they did this study, that the reason for so many health disparities among African Americans is systemic racism and discrimination. That was the bottom line of the Kaiser Foundation's research. And we could have told them that without having them spend so much money to come to that conclusion.
Right.
But I just want to go off on script and read just one little thing that I thought was so important for reasons. This is what the U.S. Department of Health and Human Resources concluded, that compared to our white counterparts, African Americans are generally at higher risk for heart disease, stroke, cancer, asthma, influenza, pneumonia, diabetes, and HIV. Now, you know that list is too long, don't you?
Very long.
That's
You kept going and going.
Right. That list is too long. But the bottom line results of that is that African Americans live on average 5 years less than our white counterparts.
Wow.
And our average age right now is 73. That's the life expectancy, 73.
Wow.
And that's compared to 78 for white counterparts. Now, if you look at the whites that live the longest and the blacks that live the least, there's a 10-year gap.
Wow.
White women live to be 81 and black men 71.
Wow.
So, you know, that's a lot to think about and a lot to try to address as we move forward. So one of the things that helps you that research shows helps us all, regardless of race, to live longest is to have some health insurance. Because then you go into the doctor, you can get treated, you can be taken care of. And so that's why we focus so heavily on trying to make sure that people understand that to start with, and then to see if they can't be able to be provided with some health insurance somehow.
Right, right. Yeah, it's like you address so many issues, and I know we're not specifically here to talk about the pandemic, but it's like that was the time when, we were seeing, this many deaths in the Black community, this many deaths in other communities, and the numbers were very different. And did you see or experience anything during that time that, gave you maybe even more fuel or passion for what you're doing?
Yeah, absolutely. Blacks were dying at twice the rate of our white counterparts. So that was the bottom line result. Everybody lost life expectancy during that time. Life expectancy at birth, we did have 75, and it went down to 73 years old, a life expectancy. So both of those things were just dramatic. And we were being sent to the hospital with COVID more than twice as frequently as our white counterparts.
Yeah.
And I'll say, interestingly, that Asian Americans have the highest life expectancy at 86 years old.
Wow.
And Asian Americans have had the very lowest incidence of COVID.
Wow.
So, we can learn something from that. Asian American vaccine rates, 83%, and African American and white vaccine rates are down in the 60s, low 60s, like 61% of the population is vaccinated, and 86% of the Asian population is vaccinated. So we can kind of take heed on some of those things.
Right. Absolutely. Yeah, I really had a colleague that had a challenging experience with COVID, and literally went to the hospital couldn't breathe well, and had a lot of other different symptoms going on, and had insurance even, and was seen and was sent back home. When you talk about the discrimination, when you talk about the racism and that type of thing, it's like, there were questions that were not asked, there were things that were not done, and she had to go back. She was alone the first time she went, but she had to go back, be taken back to the hospital, and her husband was there more so to advocate for her. But there are so many stories of, it's like I personally know quite a few people that didn't make it through COVID, but for those who did, it's like the whole experience was made even worse by, some of those factors you were mentioning.
Absolutely. And we have to keep in mind that COVID is not over.
Right.
COVID is ongoing.
Right.
I have two friends. My college roommate just caught COVID. She's an MD, and so is her husband. They've been very careful. She just caught COVID.
Mm-hmm.
And my another dear friend is just getting out of isolation now. So it's ongoing, and we have to continue to be vigilant.
Absolutely. Absolutely.
That's where, let me just say, wearing that mask whenever you can.
Okay.
Getting vaccinated.
Yeah.
and keeping that distance from other folks.
Yeah. And wash your hands.
Yes. Yes.
We got that lesson. I think all of us as beauty professionals are like, we already wash our hands all the time.
Right.
It's a very good practice.
Yes.
Yeah. So tell us what options we have. When we think about health insurance, some of us may say, oh my gosh, I can't afford it, or, it's just too much. It doesn't feel like it's, something I really want to spend money on. What are some of the options that we have, and why we should, maybe rethink some of our thoughts?
Well, the Affordable Care Act gave us the very best option because it enables us, so many folks, to be able to afford health insurance because the government pays for the most of the premium.
Mm-hmm.
The premiums for health insurance now based on what your age is, and it doesn't matter about your health conditions anymore. Because the Affordable Care Act just eliminated any conversation about that. But if you did not get some subsidy, if the government wasn't help paying for it, the average cost ranged between $500 and $2,000 a month.
Wow.
And that's just not something that most of us can afford. I was just looking at some numbers that said that in 20% of the African American population, a family of four only makes $26,000 a year or less.
Mm-hmm.
And that's hard to live on.
Right.
Yeah. But nonetheless, so the best option is being able to understand and get some subsidized insurance, mm-hmm. some insurance that the government will pay for. Okay. And the Affordable Care Act has provided that.
Okay, and that's commonly known as Obamacare, is that correct?
Yes, it's known as Obamacare.
Okay.
And it's known as Obamacare because it was passed during the Obama administration. Mm-hmm. Obama pushed for it, and he signed the legislation. And right. That legislation provides more than just subsidized health insurance premiums. It enables you to stay on, first of all, as I just mentioned, your pre-existing conditions. If you have heart disease, if you have cancer, if you have diabetes, the insurance companies can no longer take that into account. Mm-hmm. You cannot even be asked those health insurance questions.
Now, is that across the board, or is that just with the Affordable Care Act or Affordable Care Insurance?
The Affordable Care Act extends across the board.
Okay.
So anytime you are getting health insurance, mm-hmm. unless it's that short-term health insurance, and I think that's now been exempted as well, you will not be asked any questions. Now, if you're over 65, then that's a different situation.
Okay.
But under 65.
Okay. Well, that's really huge news, not necessarily new news, but for some it may be that it's across the board because before, tell us what it was like before, this was an option, because a lot of people weren't qualified to get insurance coverage at all, correct?
That's exactly right. They could not even get insurance. And not only could they not get insurance, but those who did get insurance uh, had to pay
Hmm.
incremental amounts. So
Right.
now they can't charge you any incremental amount. Also, I think another big thing is that there is no lifetime limit as to the amount of the money that insurance companies must pay for your health. So
Okay.
before Obamacare, if you reached a certain limit in your care, they could stop paying for it.
Right. Okay.
But not any longer. No matter what your bill is, no matter how long you have to have care, they have to continue to cover it.
Okay. Okay. Well, that's definitely really good to know.
Yes.
So, what else do we maybe not know about, what this is and why we should, you know, really look at it? Who can qualify?
Yeah, most people think that they wouldn't qualify for a subsidy, but most people do. As a matter
Okay.
of fact, some 90% of the people who apply get a subsidy. Anybody can apply for insurance through the marketplace, as they call it, which is the marketplace is just the system that uh, oversees Obamacare. So,
Okay.
so anybody can apply through that system, but you can only get insurance, get a subsidy, if you are a U.S. citizen
Hmm.
and you file taxes
Okay.
and you're not incarcerated. So those are the only three things that would um, prevent you. If you have been incarcerated, but you're no longer incarcerated, you still qualify. So
Okay.
don't think that you don't qualify if you've been incarcerated, because certainly you do.
Okay. Okay. Well, all of that is excellent. And so, is there anyone who wouldn't qualify other than what you've just talked about? So it's not age,
You
it's not
must, no,
race,
not
it's
not
not
age,
health,
but income does matter.
income. Okay.
Income does matter. There's a minimum income that you have to make during the year, and then there's a maximum income. Well, they just in the last several months took away that maximum, so you can make as much as you want, but the more you make, the less money they will pay for you. The
Got it.
less you make, the more money they'll pay for you.
Okay.
And in most states, in the Medicaid was expanded so that if you didn't have any income, you could in fact still get Obamacare. But
Okay.
North Carolina, our state, was not one of the states that expanded Medicare.
Okay.
Now, at last, they're thinking about doing so.
That's
So
Medicaid, correct?
Medicaid, yes,
Okay.
not Medicare. Thank you. Yeah,
Okay.
Medicaid.
Okay. Yeah.
Yeah.
North Carolina is like we seem to have our own things going on. So,
Yes, we do.
but all of the other 49 states, it has been expanded. Is that
No, not all of them.
not all of them?
Generally, the ones that have Republican governors did not expand.
Okay,
So,
the Medicaid.
and
Okay.
and the ones that have Democratic governors and many of the Republican governors, no, and some of the Republican governors
Okay.
expanded Medicaid.
Okay. Okay. Well, it sounds like it's available, for people. It's like, are there any reasons that you see that people are like still hesitant to, go ahead and jump on the marketplace and see what their options are?
Well, I think that most people don't understand how to get it done. It can be confusing. So that's why we tell people, if you know a good healthcare agent, insurance agent, talk to that agent, because
Mhm.
just one or two differences in the answers that you provide to the questions that are asked could make a difference as to whether or not you will be able to get a subsidy. You could get insurance, but whether or
Mhm.
not the government will pay for it. Um,
Oh, okay.
and
Okay.
so it makes a difference. Yeah.
Right. Okay. And so those are services that your company offers as well?
Yes, we've got agents who can assist with that. We
Okay.
can
Okay. So that we
help you
get
to
the right answer,
understand,
right,
right?
get the right insurance coverage and the right
That's
subsidy.
exactly right. Yeah.
Okay. Now, is there open enrollment, as they say, where you can do it year round, or are there only certain time frames when you can actually apply?
I tell you, so the rules have kind of changed in that regard under the Biden administration. Um, there is an open enrollment period where everybody can apply, and that open enrollment starts November 1st. And when you apply for starting November 1st in the open enrollment period, then your insurance will start January 1st to the next year. So if you were to apply in November of this year, your insurance would start January of 23.
January.
However,
Okay.
mhm. However, there is an opportunity for people that's called an SEP. That's an exceptional enrollment period. So there's an opportunity for people whose income falls below a certain level to be able to get insurance year round now, at least right now.
Okay.
So they have an SEP that allows them to get insurance right now. So you should check to see whether or not your income is in that area where you could get it now. Because if you start an SEP, the month that you apply, then the beginning of the next month, you get insured.
Okay.
And if we applied today, then tomorrow we would be insured.
Wow.
Yeah, if we could do an SEP.
That's
And
that's
there's
phenomenal.
some other exceptions too, other kinds of SEPs other than income. If you're just moving into a new county that has different rules than the old county, then you could get one from out of state. If you just turning 26 years old, you can stay on your parents' insurance now until you're 26. But when you're turning 26, you got to get your own. So that would enable you to get insurance now.
Okay. Okay. That's really good to know because it sounds like it opens up a whole, back door, if you will,
It
for
does.
people to
Yes.
get the coverage that they need right away.
Right. You're absolutely right.
Yeah. Yeah. And with the coverage that we're getting from the Affordable Care Act, does it differ from, what we might get on any other marketplace, or what could we expect when we go to see our doctors, to see our, on any, I hate to say emergency basis?
And I'm so glad you asked that question, Nikki, because that's another misconception. The Affordable Care Act insurance is not insurance that is run by the government. It is insurance that is run by private industries. So the government pays Blue Cross Blue Shield or Bright Health or Humana or whoever offers insurance in your area. The government pays them to provide insurance for you. So the same insurance that you're getting, if you were to pay the full price to these insurance companies, is the same coverage that you would get if the government helps you pay for it.
Okay. Okay. That's really good to know.
Yes, people don't understand that, and it is important.
Yeah. Yeah. Because sometimes you can feel like, oh, well, I might be marginalized if I do this or
Right.
that to the side.
Right. When you get your insurance card and
Mhm.
you take it to your doctor, they don't know whether or not you got it from.
Mm.
They don't know whether the government helped you pay for that policy or not.
Wow.
Yeah,
That's important. So I'm glad
it
you
is.
shared that with us.
Yes.
Yeah.
Mhm.
Yeah, and you said you partner with, people in the community across the country to be able to help people, in our community with this. Can you tell us about some of the relationships and partnerships that you have?
Yes, we have worked with all of our segments of partners, our churches and beauty salons and barbershops. Lafayette's team has put together Urban Call Publications,
Mhm.
which is a publication that addresses various issues for companies or simply because we know that they need they need this education to go into our communities. So he's put together these publications, and we circulate them, again, tens of thousands of them
Mhm.
throughout our networks to be shared with their constituents.
Okay.
So Yes. So
And that has all of those have ways that they may be able to contact you if they don't have, someone local in their area to help them
yes,
with this.
yes. That you're
Okay.
absolutely right.
Okay. Awesome. It's such a great service, to provide. And I think you're doing some things with heart, and working with, I don't know, salons with taking blood pressure and kind of seeing where people are falling in that. Is that
Well,
something?
we've been working with the American Heart Association,
Okay.
and that is actually their program that we wish we could find ways to help them expand. But we've been at least educating people about the program.
Okay.
And so,
Yeah.
yes,
Yeah.
our partnership with the American Heart Association has helped tremendously in
Beautiful.
providing information that's valuable to our consumers.
Awesome. Yeah. It's like, we talked about heart disease being really rampant in our communities as
Yeah,
well. And high blood pressure is definitely something that, when you think high blood pressure, you think, Black people have it more than any other race.
absolutely.
Yeah.
Yes.
Yeah. So that is wonderful. So, how can people get more information on, what you're doing?
They can go online to the Urban Call, and we can send them information online information. They
Okay.
can also call us directly
Hmm.
at 336-759-7477.
Okay. And we have that scrolling across the bottom so you can take a look there and grab the phone number. But repeat it for us one more time, just in case.
It's 336-759-7477.
Okay. Great. And you said we could reach you through Urban Call. So tell us how to do that as well.
Well, I think that number is still the best number to call to
Okay.
stay.
Call.
Mhm.
Okay. Okay. Awesome. Yeah. It's like you guys are doing such wonderful work. Is there anything else that you'd like to share or add to our conversation today?
I think I covered most of the things that I felt really are essential for consumers to know.
Hmm. Are there any stories that you could share with us about, someone who the insurance really made a difference for?
Yeah, we've got a million stories. And this, this is, of all the things that we do, this is the thing that I enjoy most, interfacing with people. I had a young man who was in the hospital. We had been talking about getting him insured for a while, and one thing or the other was preventing us from getting it done. But he found himself in the hospital with COVID
Mhm.
and needing some special care, really special care. And we were able to get him insured while he was in the hospital with COVID. So
I want
that
to ask,
was
how do you do that? But
right. So that he qualified based on his income
mhm.
for that special enrollment period.
Okay.
So we were able to get him that SEP is what it's called. So if you're
Okay.
talking to somebody, SEP is the term you want to use to see whether or not your income is within that area that will enable you to get insurance now. So
Wow.
that was one thing, and there was just so many different situations. Young lady who had no income, and then she did get a job, but her job had no coverage. As so many of the hourly workers have no coverage at all, and
Mhm.
something needs to be done about that. But that's another story. But
Right.
she had no income, and then she got income, and was able for the first time ever to get some health insurance. And she was just absolutely overjoyed.
Mhm.
And she was one of the people who had tried to go online
Oh,
to the marketplace, which is healthcare, then that's important, healthcare.gov. That's the marketplace that you go to get health insurance if you don't have anyone to help. So healthcare.gov. So she had tried, but she wasn't able to fill out all of the information. And we were able to help her get that information filled out. And she got her health insurance for the very first time. So, you know, and it's that's so gratifying,
Right.
to be able to be of some real service to people.
Yes, yes. And we spoke about the, the whole discrimination piece and how they've actually done the study to say that that is one of the biggest factors. But I think, when we don't have health insurance, we don't tend to go to the doctor for just our, physicals, our checkups, making sure that everything is okay. And, or if there is something that's a little, not as we would want ideal, it can be treated earlier instead of catching it later because we hadn't been going to the doctor. So I think it's like so important that we look at, like even that as part of the picture. That
Yes.
in coverage, you're actually able to go in and get your physicals and, any prescriptions and medications that you may need.
Right. And it's important, again, Mickey, that you point out that prescription drug coverage is a part of the policies.
Hmm.
That's mandated. Again, that's the Affordable Care Act.
Right.
It's mandated that part of the insurance policies must include prescription drug coverage. And it has to include, for children only, it has to include dental and vision. It's just basic dental and vision, no advanced dental and vision, but at least it's something to help cover children.
Yeah, yeah. And starting out kids with great dental health and definitely keeping up with their vision because I know there's kids out there that need glasses that haven't been examined and are struggling because they can't see well, not because they can't learn.
That's exactly right. There are 10 essential benefits that that all of your policies must have. And so one of the things, for example, is preventive coverage at no cost to you whatsoever.
Great.
You have to be able to get your colonoscopy and your mammogram, your annual wellness exam, all of that preventive stuff has to be covered. Again, that's
Awesome.
some of the 10 essential benefits of Obamacare.
Yeah, that's fabulous because that really kind of at least starts to flip the script on us getting the care that we need from the beginning.
Yes.
Being able to afford the care that we need from the beginning, from getting this affordable subsidy and being able to have the coverage, go into the doctor and, get ourselves taken care of because our health is the beginning and the end. It is our asset.
Right. And again, based on population, based on your income level, many people don't pay any premium at all. They don't have to pay. Yeah, the government will subsidize the entire cost of your premium.
Wow. So there's no reason not to take a look, right?
Right. No reason not to look. At least
Yeah.
look. You're absolutely right.
Yes. Well, I so want to thank you for just sharing this information with us because I think, obviously I'm part of the beauty community as well, but I'm a business coach. And so I work with, people in other areas, but a lot of us are self-employed. We're independent contractors. We, like you said, this is kind of a gig economy. And so this gives us options that we don't have through an employer anytime, anyway, because we don't necessarily work for a company, a big company or what have you. And so I think it's super important that we as individuals, as, independent contractors, even as business owners, that we look at, what these options are so that we can have that piece in place as we, pursue the other parts of our business.
Yes, and I've heard of the good work that you're doing. I think that's wonderful. Yes. And I'm sure that all of us appreciate the things that you bring to the table.
Well, thank you very much. I appreciate it. Yes, it's like I'm definitely committed to us, excelling in our industry and being able to live, the lifestyle that we want, to live comfortably and be able to, have our health, have our wealth and be able to take care of our clients. And so I think this is so vital. So thank you.
Yes, thank you.
Yeah. So I want to thank you for being here and just sharing with us, a lot of things that, I didn't know. And I'm sure some people watching are like, oh, wow, this is pretty interesting. So again, tell us how we can stay in touch with you. How can we get Urban Call, on a regular basis if we're a salon or business that may want to partner with you? Are there, is it still that same phone number to contact you?
That's the best way to reach us.
Okay.
Yeah,
Okay.
that same number. Yeah.
Okay, so perfect. So contact Sandra Miller Jones, and it's at 336-759-7477.
Yes.
And I want to thank you for being here. I want to thank everyone for watching, and I look forward to seeing you next time. Again, my name is Mickey Wright. I'm with BeautySuperstars.com, and I help hairstylists go from struggling to superstar. And I want to encourage you all to keep reaching for the stars, and we shall see you next time. Welcome to Beauty Superstars Talk, your backstage pass to experts in beauty. My name is Mickey Wright, and each and every week I have the privilege to interview Black beauty bosses who are doing amazing things in the beauty industry. We give voice to their stories and celebrate their excellence while they drop nuggets to help all of us become better beauty pros and better entrepreneurs. More than a podcast, this is a movement to encourage Black excellence, entrepreneurship, to preserve our history, and to bring healing to the beauty industry. Hello there. Welcome. My name is Mickey Wright. I'm with BeautySuperstars.com, and I'm your host for today on Beauty Superstars Talk, which is your backstage pass to experts in beauty. So I want to thank you for joining us. And when you mention beauty, it's hard not to think of health and beauty. And for many of us, we can sometimes take both for granted until they start to change. And today we are here to talk about your most valuable asset. You may be saying, maybe I don't have any stocks or bonds or other assets. Or you may think, well, I guess my most valuable asset is my home, right? But no, your most valuable asset is you and your ability to provide for your family. And it really is all about your health. And so the recent pandemic that we had really helped to shine a light on one of the biggest challenges that we face in the US, which is the health gap. And that's between African American and Hispanics and the general population. Whether it's finding quality health care, preventing or treating diseases that run rampant through the Black community, such as diabetes, heart disease, or cancer, or accessing affordable options for health care, insurance, and prescriptions. We really need an ally. And we are blessed here today to speak with an expert who is great here with asset protection for you and your loved ones. She's a healthcare advocate. Her name is Sandra Miller Jones, and she's passionate about providing solutions. She's also an insurance expert whose company specializes in affordable care, health insurance, Medicare, and final expense insurance. And so I am super honored to have you here today. And before I really jump right in and welcome you formally, just like to share a little bit about you. I'll share your bio and we will get started.
Thank
So
you so
welcome.
much, Mickey. I appreciate that.
You're very welcome. Mrs. Sandra Miller Jones is a longtime entrepreneur whose passion and corporate mission is to help improve the health of African American and Hispanic communities nationwide. After graduating cum laude from Howard University, Mrs. Jones went on to become one of the first African American women to receive an MBA from Northwestern University's top 10 Kellogg School of Management, and then the first female African American marketing executive for the Quaker Oats Company. Mrs. Jones left Quaker Oats in 1978 to establish SMSI, a national marketing services company that now has outreach teams in 35 major U.S. markets, operating under the banner of SMSI Healthy Living Solutions. SMSI's client list includes Procter & Gamble, Blue Cross and Blue Shield, Quaker Oats, Humana, AARP, General Mills, and many other national brands and organizations. Mrs. Jones is married to her business partner, Lafayette Jones, and the couple have one daughter, Dr. Bridget Jones Brooks, an orthodontist who lives in Atlanta with her husband, Patrick Brooks, and their son, Easton. So I want to welcome you. How are you, Sandy?
I'm doing well. Thank you so much. I'm glad you mentioned Easton. That's
Yeah.
our first grandchild. He'll be 1 year old, July the 23rd.
Oh, wow.
So
Coming up
we're,
quickly.
yeah, we're still excited about him.
Awesome. I bet you are. That's awesome. And you are quite a powerhouse. And so it's like I really am excited to have you here and for you to share with us today. It's like you have been in business for, it said 1978, so that's about 40 years. Is that
Yeah,
accurate?
42 years now.
42. Oh, wow. It's like, congratulations.
Thank you.
So tell us more about SMSI. What exactly does it do, and how do you incorporate that with your passion for healthcare?
Yeah, so you noted that we are in 35 markets, and what we do is distribute information to constituents throughout the various markets in which we find ourselves. Information that's important to these constituents, as well as product samples, free product samples. We've distributed millions of free product samples over these many years. And we're privileged to be able to work with our community partners in order to get this done. So we've got about 10,000 churches, African American and Hispanic churches, and 40,000 beauty operators and beauty salons across the nation that we work with to help us. And we have a special affection for our beauty salon partners because they have just been so kind to us and so receptive throughout the years in helping us to reach their clientele with important information and with the free product samples that we're able to provide.
Yes, yes. It's like of course, my background is as a hairstylist, and it really is, we have the opportunity to interact with so many different people, and we really have a captive audience. And so I think it's such a great thing to be able to talk about something, of substance. We want to laugh and have the gossip and have a good time, but it's like when we really have that opportunity to impact, not only the health of the person sitting in our chairs, but the health of their families and the whole community. It's really powerful.
Yes, and that community does such good work in that regard, such great advisors, and that's a wonderful thing. And we have to give a special thanks to Lafayette Jones, who's my husband and business partner, for getting us involved more intimately in the beauty industry. That's been his passion for many years as well. So that perhaps some of your listeners will know of the good work that he's done over the years in the beauty industry.
Yes, absolutely. It's like we salute Mr. Lafayette Jones, and I actually had the pleasure to interview him as well. So definitely everyone can feel free to check out his history, his long history, and the accomplishments, not only, that he's done in the industry, but the contribution he's made to the industry with working with many of the top brands that you would recognize at the drop of a hat. So
yes,
we definitely commend him. And so tell us a little bit about the programs that you guys offer through SMSI. You have the Healthy Living Everyday initiative or programs.
Yes.
That consist of?
In addition to distributing information through our networks and distributing samples, we've done education programs that include seminars on various health-related topics, and ambassadors. We've got community ambassadors who actually visit our venues and our gatekeepers to talk about some of the things that we know are important to our community. So we've done such things as some fun things, like for Mrs. Dash, we talked about the importance of a low salt diet. And in order to do that, we had chefs in multiple markets, African American chefs, to make spaghetti with Mrs. Dash and no salt.
Okay.
And then we distributed this spaghetti to 50,000 gatekeepers, and were able to get their endorsement to their constituents that it could be, you can have some good food without putting salt on it. So that was one of the many fun things that we've done.
That sounds delicious. I wish I had been there.
Yeah,
I love Mrs. Dash. So
yeah, good, good. For those people who don't know Mrs. Dash, it's a seasoning product
yeah,
that does not have salt in it. Yes.
yeah, and I love the garlic. That's my favorite. So,
Oh, great, great. Okay.
yes, but tell us, like, how did you get involved with, or with, where did your passion come from for this, healthcare initiative?
Well, for healthcare, it's a passion that I've had throughout my life because my mother and father were people who volunteered in the community to do things that might be beneficial to our neighbors and friends. And one of the things that we always noticed was that there were so many health issues that were prevalent in our community, even when I was growing up as a child. And even in my family, my father had diabetes, my mother had heart disease. And so there are just lots of evidence of the need for some health education and some things that would help to reduce some of these incidences of these tragic diseases throughout our community.
Right.
And so when we started in business, we tried to do things always that could be helpful in reducing and health disparities was not a thing that we talked about then because we didn't realize that how great the disparities were, but just make things better in general.
Hmm.
But then over the last 10 years, we've started to focus very heavily on just improving the health of the communities in which we reach. And that's why we kind of changed our banner recently to Healthy Living Solutions from it was SMSI. SMSI stands for Segmented Marketing Services, Inc.
Okay.
So we changed our banner from Segmented Marketing Services to SMSI Healthy Living Solutions.
Yeah, that's incredible. It's like we definitely need it, and I think the gap. I don't know if it's gotten wider or not, or if we've just gotten more visibility about the health gap, but it definitely exists.
Yes, absolutely. There's tremendous disparities between our white counterparts and our ourselves as African Americans.
Right, right. Yes, absolutely. And it's like we talk about health insurance. Why is it important for people of all ages to have health insurance?
Because these health issues are so prevalent, and many studies have shown that people who have health insurance are less likely to be ill, to contract the diseases that are so prevalent among our population, and to die from them. And that's a really important
Right.
component of it. The life expectancy between African Americans and whites in the U.S. is broad now, and it increased within the time that COVID has been uh, a tremendous um, factor in our lives over the last 2 years.
Yeah.
Average African American lives to be about 73 years old, and the average white citizen lives to be about 78 years old now.
Wow.
That's 5 years of life that
Right.
we need to try to gain on.
Absolutely. Yes. So we're here today to talk about Medicare. And, it's like we have these conversations that could be a little scary to try to navigate and figure out. But I know there's confusion sometimes between Medicare and Medicaid. So can you clarify that for us?
Yes, Medicare is a government-run program that is usually for people that are over 65 years old.
Okay.
And it doesn't matter what your income is. If you're over 65, you probably will, and most likely will qualify for Medicare. Medicaid is a program where income does matter. So if you're in a lower income situation, or if you're disabled, then Medicaid is a program. Again, that's a government and state-run programs. So
Hmm.
U.S. government runs Medicare, and Medicaid is run by both the state and the U.S. government, and
Oh,
it is for lower income and um, disabled.
okay. Okay. I think that helps clarify it. So thank you for that. And we want to talk about Medicare. So why why do we want to talk about Medicare? What is the importance of that, and what happens to, I guess, many of us as we turn 65? You know, I've heard it's a have to, not an option. So tell us from your experience what that looks like.
Right. So much confusion about Medicare. When people are turning 65, they get so many messages. Some of them are clear and some of them are not. And one of the most important things is to try to give people some clarification as to what is Medicare and what can you do and what do you have to do to make sure that you do have Medicare eligibility. But let me just talk about Medicare in general, first of all. Um, there are three ways that Medicare can be provided. You can do, uh, when you're 65 years old, if you have worked at least 10 years throughout your um, lifespan of work history, um,
Okay.
then you are and pay and your employer, if you or your employer paid into the Medicare system, then you're eligible for Medicare.
Okay.
There's original Medicare, and original Medicare covers both your hospitalization. That's where they talk about these various parts of Medicare. So Part A covers hospitalization and hospital expenses, and Part B covers your doctor's expenses and related doctor's expenses. So that's Part A and B. You automatically get Part A if you've worked the 10 years, like I said. Part B, you have to pay the government for. And you will automatically get it, but you have to pay for it. This year, and most people have it taken out of their Social Security benefits. So this year, the cost out of your Social Security benefit of Part B is about $160 a month. So whatever your your Social Security amount is, $160 is going to be taken out to cover your Part B. So if you just have
Okay.
basic Medicare, you get Part A and Part B with your paying Part B. However, your basic Medicare only covers 80% of your expenses. So that means that 20% of your expenses you're going to have to come out of pocket for, unless you have another kind of Medicare service to assist with that expense. So you can have original Medicare, and then you could add to your original Medicare um, a Medicare supplement. That's not any of the parts. Medicare supplement is not Part A or B or anything. It's just a supplement that goes with your original Medicare. And that supplement helps to cover that 20% of the cost.
Okay. So can we just pause there? I just want to make sure
Yes.
everyone's clear. So we've got, when we turn 65, if we work 10 years or more in our career or lifetime, then we would be Medicare eligible and we would receive Part A automatically. And we would receive Part B automatically, but we have to pay for Part B. And typically that's going to come out of your Social Security check.
Yes.
Okay.
Yes, you got it. That's
Okay.
exactly right. Yes.
And A and B together only cover 80% of your expenses. And so the rest, if we want that covered, not coming directly out of our pocket, we need to consider a supplement.
Right.
Okay. Okay. So take it from
All
here.
right. Okay. So the supplement, if you decide you want to consider a supplement, you have to pay for the supplement as well.
Okay.
And original Medicare does not provide drug coverage. So then you'd have to buy also a drug coverage plan. And it's required that you have a drug coverage plan. So you're going to have to get it.
Wow.
There are some exceptions. Let me just say that there's always some exceptions to everything. So those are the exceptions. When you actually get into the details, you have to look for those exceptions as well. So
Okay.
you got Part A and B, and then you got a supplement to pay for, and then you got a drug plan to pay for. That's one thing. Now, Part C. Part C is what they call Medicare Advantage. And this is, again, this is the supplement you buy from private insurance companies. Medicare Advantage is provided by private insurance companies.
Okay.
And Medicare Advantage covers all the parts: Part A, Part B, and drug coverage, which is Part D. That's drug coverage.
Okay.
All of that is wrapped up into one policy, and the government pays the private insurance company to manage your Part A and Part B, manage your hospitalization, manage your doctor's care, manage the things that go along with each of those. Medicare Advantage plans must provide everything that original Medicare provides. So, so if you're gonna your Medicare Advantage plans have become extremely popular because they're very competitive, as you can see from all of the ads that you see on TV.
Right.
But these Medicare Advantage plans, you can get a Medicare Advantage plan that doesn't require you to pay any extra premium. You don't have to pay anything to the insurance company. You can get one, and a good one.
Okay.
And you don't have to pay for the drug coverage in your Medicare Advantage plan. So if possible, then you'll be looking for a Medicare Advantage plan that you don't have to pay any premium to the insurance company for, that gives you your drug coverage at no incremental cost, and that gives you some other extra things as well.
Okay.
So yeah, look very carefully at Medicare Advantage if you're looking for some Medicare coverage.
Okay.
You must have Part A and Part B in order to get a Medicare Advantage plan.
Okay.
Yes, because that's that Part B amount of money that you're paying that's being sent to the insurance companies.
Okay.
So
Okay.
they
Still pay the Part B, but
right,
it's being sent there. Okay.
but no, nothing extra. Yeah.
Got it. Okay.
So,
Okay. So what about things like I don't think those things that you mentioned cover things like vision and dental. What
yeah.
about those type of, I don't know, supplements, if you will?
If you get the right Medicare Advantage plan,
Okay.
it will include basic dental and basic vision. And when I say basic, that's for dental, for example, that's 2 cleanings a year, and the x-rays that go with that. That's basic.
Okay.
And basic vision is some your once a year getting your exam, and some kind of subsidy for your lenses and your frames. That's basic.
Got it. Okay. Okay. So are there any other options to have more than basic, or those are pretty much the options and everything else would be kind of out of pocket?
You can buy incremental dental plan.
Okay.
And you could buy an incremental vision plan as well. But there are not a lot of vision plans that cover more than basic.
Got it. Okay. Okay.
Dental plans can cover a lot more.
Okay. So how does the process work? It's like, okay, we've got some folks out there that are maybe 63, maybe 64, and it's like, what in the world is going to happen in the next, year or so?
Right. If you qualify for Medicare, Medicare will start to send you information as early as 6 months, and certainly no later than 3 months before your 65th birthday.
Okay.
So they'll send you to let you know whether or not you qualify.
Okay.
And
Okay.
then you'll know. But if you are really concerned and want to get some information early, you can always call 1-800, yes, you can call them, 1-800-Medicare.
Okay.
or go online to Medicare.gov
Okay.
and you could get some early information. You could call us, but we don't know what your particular situation is. So,
Right. Right. And so is that really the advantage of working with, with you or someone like you, for that assistance? Because, it's like you say Medicare Advantage, and it's like, okay, that sounds like a good thing. But, with everybody, their situation's going to be individual. And how do we know which plan is going to be the best for our situation?
yes, yes, you're absolutely right. Working with a certified, licensed uh, agent who has studied all of this information, and who has various clients that they work with, rather than just to dedicate somebody. Well, you could do either of them. I don't want to say that people who just work with one
Mhm.
plan can't be objective, but they could be. But if a person works with a number of different companies,
Mhm.
Humana and Blue Cross Blue Shield and um, Aetna and Cigna, those are the top ones,
Okay.
then they can compare for you the different options. And for Medicare, for Medicare Advantage plans, there are different options based on the state and the county in which you
Wow.
live.
We need some
Yeah.
help, right? Navigating all of that.
Yeah, exactly. Uh-huh.
Yeah, it's pretty interesting, just hearing it all broken down. So we definitely appreciate you making it simple for us.
Mhm.
So, it's like if we don't have someone that we're working with or someone in our area, it's like how can we contact you or your company to help assist us with that process?
Yes, again, just give us a call at 336-759-7477 and
Okay.
leave a message, and we'll get back to you within the day.
Awesome. Yeah, and that is scrolling right below, so you can take those numbers down. Will you repeat it for us, please?
Sure. 336-759-7477.
Awesome. Okay. Yeah. So we will definitely, I think we'll be giving you a call to see what the best options are, because it sounds like there's quite a few options.
Yeah,
And, like when you say that it's like even broken down by state and county, it's like, wow, how do we begin this
yes,
process?
yeah.
So, are there any other things that someone should know about Medicare, before we start the process, or information you might need for us to, be ready to provide?
Yes, you should really try to get started about 3 months prior to your birthday,
Okay.
your 65th birthday.
Okay.
Because if you have, sometimes if you're employed and your employer has been paying your Part B portion of your Medicare,
Mhm.
and then when you retire or leave your job, then you may have to start paying it. And if
Mhm.
that's the case, you're going to have to sign up for it, and so that could be take some time.
Okay. Okay. And many of us, I'm obviously in the beauty industry, are, we work independently, we may be self-employed, we may be business owners, all of those things. And of course, there's so many people that are just part of the gig economy right now in the
That's
US.
right.
And so, are there any special things that we may need to consider?
No, again start 3 months before
Okay.
your birthday, because then you can see if there are things that have to be considered because you're a self-employed person, or as you say, a part of the gig economy.
Okay.
Yeah.
Okay. And you spoke about Social Security. It's like if we're in a position where we're not getting Social Security, do we still need Medicare?
Yes, you still need Medicare.
Okay.
Yes,
Okay.
yes, and you can, instead of the money coming out of your Social Security check, then you can pay directly for
Okay.
coverage that you need.
Okay. Okay. Well, this is definitely eye-opening to see how this whole process works. And Is there anything else that you'd like to add about it?
Mm, I don't think so. I think that those are the basic things. It depends so very much on an individual's um, unique situation
Hmm.
that it's dangerous to do too much generalization,
Right.
and that's why it's dangerous to listen to commercials that don't have too much specifics. I know that one of the things that I guess I should add that you need to be based on your income. There's often an opportunity to get help from your state to pay for your Part B
Mm,
premium. And therefore, it wouldn't
okay.
have to come out of your Social Security. So and that's probably the only generalization that I think would be safe to make.
Okay. Well,
Mhm.
that's good to know. That's good to know. But definitely, it sounds like we need to have an expert, which we value um, the opinion of and the experience of.
Yes, Mickey, I think that that's extremely important for Medicare um,
Mm-hmm.
recipients. Nobody, for example, is supposed to call you to solicit your business on Medicare. There's a law against that. They
Mm,
can send you a postcard, a mailer, but they can't call you unsolicited
okay.
to ask you to be a client of theirs.
Okay. Yeah, definitely we need to know that.
Right.
So,
Right. And also, before you start to work with anyone, even though you might trust them very much, they have to get your written permission, and there's a form that has to be filled out to say that you agree to have them talk to you about Medicare.
okay.
So, right. So make sure that that form is provided and on file.
Okay. So many things that, we just don't know. It's like it's not taught anywhere, it's not discussed anywhere. So we definitely appreciate you really taking us through this, step by step and taking a lot of the confusion out of it because it is like what? Yes. So, yeah, I want to thank you for being here with us today. And again, tell us, how we can contact you should we have any further questions. And, you offer final expense insurance as well as Affordable Act or Affordable Care Act insurance. And so
Obamacare.
Obamacare. And so tell us how we can, contact you and, have some conversations about what those things may look like and mean for ourselves and for our family.
Yes, just call us at 336 That's 336-759-7477. And just leave us a message and we'll get back to you in a day.
Wow, that sounds great. So thank you so much. It's like you're doing such great work for the community and, really walking us through this journey, which, we're all lucky, I guess you could say. It's like we will be crossing into, dealing with Medicare and getting it set up. And we would definitely want to make the best decisions for ourselves and to be able to move forward with that. So,
Yes,
again,
and we thank you, Mickey, for the excellent work that you do,
oh,
the
thank
service that you provide. We really do appreciate it. I've heard such good things
you.
about the services that you have provided.
Yeah, well, thank you so much. It's like I've been in this industry for so long. I'm definitely committed to the success of the people in it and being able to, be a salon business coach to have Beauty Superstars Talk, where we actually get to have these conversations that are much needed in our community. And done over 80 interviews and
Oh, my.
with
Wow.
beauty bosses. And so there's a large library. So for anyone who's
Yes.
interested, you can check them out, including my interview with Lafayette Jones on my YouTube channel, which is Mickey Wright. And it's just Miki. Just everyone always wants to give me extra letters, but just Miki, WRIGHT on YouTube, or you can catch me at beautysuperstars.com.
Wonderful. Wonderful.
Yeah, yeah. So I appreciate this opportunity and definitely look forward to hearing, what's going forward, what we need to continue to look at, because I know things are always changing.
Oh, yes, absolutely. Mhm.
Yes. So thank you so much. I want to thank everyone who's been here with us. We appreciate you and your time, and encourage you to keep reaching for the stars. Mickey Wright with BeautySuperstars.com. I help hairstylists go from struggling to superstar, and look forward to seeing you next time. So take great care, everyone.
Every year, more women have strokes than men.
Did you know that heart disease is the #1 killer of women?
Women, especially Black and Hispanic women, are disproportionately impacted by heart disease and stroke. Without the research and the breakthroughs of the American Heart Association, I would not be here.
Get it, slip it, cuff it, check it. Talk to doctor now and share it.
Get it, slip it, cuff it, check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
Well, we have in our family a big history of heart disease, cardiovascular disease, and my father died at 45 of a massive heart attack. And it was pretty easy to say, maybe I ought to try and do something to help not just me, but the next generation of Lingenfelters, and certainly millions of others. As you know, it's the #1 killer in America.
There are no demographic boundaries to heart disease. It affects everybody in terms of young, old, of all races, of all genders. That's how I got involved in the Heart Association, is by suffering from heart disease.
I belong to some other professional organizations. They help represent cardiologists. The AHA is so much more than that. It's where a young person goes to launch their career in medicine. It is where the community turns to for advice as to how to take care of important medical issues.
And in Atlanta, we're blessed to have a number of universities and colleges, and at least 3 or 4 medical schools within a reasonable distance of the center of the city, who deal with research into heart disease, cardiovascular disease.
The advocacy side of what the Heart Association does is incredibly powerful, and I'm most impressed by that.
We're only as strong as our weakest link, and we need to make sure that everyone in Atlanta continues to have accessibility to all those things that they need to live a healthy life.
What I think makes Atlanta very unique and a special city is the fact that it has such a diverse population. And if you think about what the Heart Association is trying to do to solve this issue and problem in multiple communities, this is a great microcosm to make that happen.
I'm hopeful, I'm going to be helpful, and I'm going to be engaged over the decades with the American Heart Association and bring my friends and organizations in, because we all have a responsibility to work hand in hand, not to sit back and say the American Heart Association should do it. We should be working in partnership to make sure we're all working to get the job done.
In the age that we're in with this pandemic and the broad scale of this, that scale is not new to cardiovascular disease. It's been there every year. We need to continue to focus on it so that we can all have the tools and be educated to live a healthy life with the bodies that we were given.
We only get one body, and so we have to treat this body as being as important to us as making money or making a living. I tell folks, if you're going to be here for your children or your grandchildren, then you got to take the steps today to make sure you protect that heart, not just for love, but that heart to live.
The future of heart disease is really prevention, building healthy lifestyles, and finding the ways that we can reduce the burden of heart disease. And the AHA has been ahead of the curve there. They've realized that we both need to treat someone who now has very severe heart disease, who may need a heart transplant, but we also need to think about the 8-year-old in the community. How do we have them have a healthy cardiovascular life?
I think the community aspect is a big part of the future because it's something that we all need to address and be responsible for the health of our community. And I think the American Heart Association's impact is just getting started.
I think with the work that's going on now with the American Heart Association, we're going to have a healthier society. We will significantly reduce the number of individuals who are impacted by cardiovascular diseases, and we'll have people who will live vibrant lives and stronger lives together. I think 40 years from now, with the work and the paving of the pathways today by the American Heart Association, our society is going to be much healthier.
Welcome to At the Heart of It. Nancy Brown, CEO of the American Heart Association. Welcome to the premiere of my new show, At the Heart of It, where we are sharing stories about remarkable people. We're having intimate conversations about how our guests are finding purpose, unleashing innovation, and maintaining well-being along the way. Discover a softer side you may not have seen before. We are all on this journey, so let's explore and discover together. It is International Women's Day, and we are exploring this year's theme, #ChoosetoChallenge. What better time than now to start something new? Today, we welcome attorney, TV personality, heart disease survivor, and Dynamo star Jones, who is here to discuss how she has chosen to challenge in her life and in her career. We will also learn a few of Star's secrets for balancing personal and professional success.
A woman who defies easy description, Star Jones. Many of us know Star as one of the original co-hosts of ABC's daytime talk show, The View. But that's just one bullet point on a long resume and just one stop on what's been an incredible professional and personal journey. Star is an attorney, a TV personality, a 3-time book author, TV producer, fashion designer, actress, heart disease survivor, American Heart Association national volunteer, a wife, stepmom, and sister, advocate for women and diversity. A North Carolina native, Star grew up in public housing in New Jersey. She began her legal career as a prosecutor in Brooklyn, New York. Later, she became chief legal analyst on Inside Edition, where she led the coverage of the O.J. Simpson murder case. Not only that, but she was the only reporter to interview Simpson during his civil trial. In the decades since, she's been impossible to pin down, but her commitment to changing the world for the better is unwavering. Star is the co-founder and principal of Instant Impact Group, a consultancy firm that champions diversity and inclusion. She is also the executive editor of Makers Lists, curating change makers for marquee who's who. Change is a constant theme in Star's life and of today's conversation.
Hey, Star, welcome and happy International Women's Day.
Hey, Nancy, it's such a pleasure to talk to you. Thank you so very much for inviting me.
Oh, I am so thrilled to have you here. You know, when I see that video, I think to myself, my gosh, you are one of my closest friends. And I look at that video and I see a whole side of you that we don't often talk about. And it's because it's a side of you that we haven't experienced together. But we're going to talk about that today.
Oh, that'll be fun. Absolutely. I look at that video and I see how much weight I've lost.
I love it. And there was a day you didn't wear red every day, too. So I learned that about you today.
Yes, indeed. But right now, of course, I've got my red on because this is where my heart is.
I know it is. And you know, I thought we would start out by having a little fun today. I call this segment my Signature 5. So I have a few rapid fire questions. I want to see how quick you are on your feet. Are you ready to play? Star, are you a morning person or a night owl?
Definitely a morning person. I get more done before 9 o'clock in the morning than most people get done all day.
I love it.
From about 5:30 a.m., I can roll.
I love it. Do you prefer multitasking or one thing at a time?
Multitasking. I learned that in law school to sort of see everything on a chart in my brain. So I just plug things in throughout the day.
Best stress relief, the spa or a workout?
No question, a spa. I just actually had a body treatment, so I can tell you it's the spa.
I am jealous. Okay, food, steak, fish, or tofu?
I think tofu is the devil. I don't even understand the person who
You and me
created it.
both. Right.
So I've given up really, really heavy meats. So fish, and my very favorite fish is branzino. A piece of grilled white fish is about as good as it gets.
Ooh, that sounds good. Okay, I'm asking you this question, not that I need to know, but our viewers want to know. Animal preference, dog or cat or something else?
Nancy.
I
come
know,
on
come
now.
on.
Give me a break. We both are in love with our dog. Are
I
you kidding
know.
me? Mimi is the love of my life. She's my mini me. Her birthday is actually my birthday.
I know.
So when I tell you she's my baby, she's my baby.
I know she is, and I'm her auntie, so you know we do love our dogs.
Yes,
Bonus
we do.
question: wine, red or white?
I'm a white wine drinker, even though red wine is a little bit better for the heart. I like a good New Zealand Sauvignon Blanc, and I have discovered that Costco has a really good one for very, very cheap.
Oh, good to know. Thank you for the tip. So, Star, let's now get at the heart of it.
Sure.
Today, March 8th, is International Women's Day, a day we celebrate the achievements of amazing women in all areas: social, economic, political, entertainment, healthcare, cultural, and more. You, my friend, my very dear friend, you are a pioneer and you're a truth teller. You continuously embody the 2021 International Women's Day theme of #ChooseToChallenge. Have you always been that way?
I think so. I've always been sort of the big mouth little girl that didn't know that she, quote, had a place. And I've always figured that I would just stand in the space that God had created for me. My parents named me Starlet. I became Star for short very early on, and I think I kind of grew into the name. Challenging the status quo is a part of my DNA, Nancy.
Yeah. So is that what made you decide to go to law school?
I decided to go to law school when I was 8 years old. Actually, I remember very distinctly the very moment I came home from school. I was living with my grandparents down in North Carolina, and I came home from school, and my grandmother was watching a soap opera. They called it The Stories back then.
Yes, they
And
did.
She was
yeah.
watching The Stories, and she was watching Another World. And there was this character, Victoria Wyndham played Rachel Corrie. I can't believe it's been so many years, and I remember this like it was yesterday. And my grandmother remarked, she said, "Ooh, that child needs a lawyer," just like that. And my mom, then and we called her Mama Merle, and my Mama Merle said, "Ooh, that child needs a lawyer." And I said, "Mama Merle, what's a lawyer?" She said, "Well, those are the folk you can depend on. When you get in trouble, they usually have your back." And I said to her, this woman with a 6th grade education, "Mama Merle, I think I'm going to be a lawyer." And she said to me, "If you say you're going to be a lawyer, that's what you're going to be." And that's just really the way it all started. Now, I can tell you, Nancy, quite honestly, she then called my mother, and my mother used it as a hammer for the remainder of my childhood. So every time I would get out of line, she would say, "Excuse me, lawyers don't act like that." And she would use it against me until she got to a point where I would talk back. And she said, "Lawyers don't talk back to their mother." And then she knew I was going to be a lawyer because my response one day was, "Oh, yes, they do, Mom. They talk back to everyone."
I can see that as clear as day. And I love that you've had your purpose identified for your life since you were 8 years old. And it really shows you, as we celebrate the power of women, how powerful your grandmother and your mother were in helping you stay the course. They tried to, they encouraged you to be everything you could be, not to have you change course, and I love that. So tell us, Star, about a moment in your life where you, quote, chose to challenge, either personally or professionally, and what happened?
You know, Nancy, actually, I can think back to that. It was a very difficult moment. I remember I had celebrated my big 40th birthday with 40 of my closest girlfriends. We all went to Jamaica for my 40th birthday, and it was just a celebration. 4 or 5 days in Jamaica with your closest friends, and it was the party of life. And it was probably the most successful that I had ever been in my career. And between 40 and 41, I gained 75 pounds. I went from 225 pounds to 300 pounds in 1 year. So it was the most successful year professionally, but for some reason, I personally was not thriving. And I really feel, based on what I know now, that I was in some sort of depression that I could not describe nor could I deal with. And I remember that a friend of mine came to me pretty much right after my 41st birthday. And she took our friendship in her hands for all practical purposes, because I'm not the easiest person to approach with something that's sensitive. I kind of pushed back.
Gee, I hadn't
Oh, yeah.
noticed. Yeah.
I'm sure no one would believe
No
that.
one believes that.
And she came to me and she said, I'm worried. A friend of ours had just passed away from a stroke. And I think most Americans and most people around the world know Luther Vandross died alone in his apartment in New York. She said, I cannot come into this apartment one day and find you dead on the floor.
Wow.
I'm worried about your weight. You can't breathe. You can't walk in the same way. You're not living your life. And I don't know what happened, Nancy. A light just really just hit me at that moment. And I said, I'm going to take control of my life and of my health. And so I reached out to my doctors and I said, I'm ready. You tell me what I need to do. To make a very long story shorter, we talked about the fact that I had gotten so out of control. I needed some medical assistance. And so we decided that I was going to have weight loss surgery. And back all those years ago, this was 2003, it required a number of doctors to talk you through this process because they really wanted to make sure you were going to be successful. And one of the doctors was indeed a psychiatrist that you had to sit down and actually talk about how you got to this point. It's one of the smartest things I've ever did. I chose to challenge what the status quo was. I chose to challenge what people expected of me. I chose to challenge what I expected of myself. And I didn't talk about it because I wasn't ready. It was very difficult to deal with the fact that somebody who was supposed to be the smart one, the one that did everything the right way, the one that was so successful, the one that other people came to for advice, it was very difficult for me to admit that that was fake. I wasn't the smartest one in the room and that I needed the help. And I was really scared that I wasn't going to be successful. And so my doctors and I, we talked it through and we said, you find your space, you figure it out, you get healthy. And that's what I did. And I have to tell you, it's that choice, Nancy, that over the course of 2 years allowed me to lose 160 pounds.
Wow.
I was 307 on the day that I had weight loss surgery. And over the course of the next 15 years, I've kept off 140 to 150 pounds.
That is incredible. I know you had help at the beginning, but I spend a lot of time with you and I see how diligent you are about making the right choices, but we all kind of go off the wagon once in a while. What goes through your head? Like, what are you saying to yourself?
Remember, I was a homicide prosecutor in the beginning of my career, and I can't tell you the number of autopsy reports that I've seen. I can't tell you the number of homicide scenes I've been to.
Yeah.
I remember reading autopsy reports, and they are very sterile. They're very matter of fact. They give you the facts. And I remember very clearly an autopsy report that said, Negro woman morbidly obese, to describe this woman who had been killed. I swore to myself, no one would ever describe me that way. And I meant that.
Yeah.
I meant that.
Yeah.
And that stays in my head all the time. So I have no question, Nancy. I'm never going back.
Yeah, I love that. And you in so many ways in your life, you have conquered a lot of challenges. And we know that many women have obstacles, especially women of color. What are the main obstacles you see for women who might, quote, choose to challenge?
Well, if we're going to be honest, it's institutional racism and institutional sexism. I mean, let's just be very blunt about it. I think about for years, as we celebrate Women's History Month and International Women's Day, when our country was founded, women and Blacks were not a part of the equation.
That's right.
Except as commodities, if you think about it. Women did not have the right to think for themselves, to act for themselves, to even negotiate contracts for themselves. Black people were not considered people. We were property.
Right.
My ancestors were property. And it took years and decades for that to change in our country. And think about the number of generations that flourished of white men.
Right.
In contrast with women or people of color. Think about the numbers of generations that were able to own property and get educated and travel the world and meet new people and interact with different cultures. All of those things grow you as a human being. Think about the men in contrast with women, whoever were able to vote for their representatives.
Right. It wasn't that long ago. It was not that long ago.
Not at all.
Yeah.
Not at all.
Right.
And it is impacting on the number of women who have run and won national office in the United States of America. It impacts on the number of people of color who have run and won national office. Those kinds of things are impediments. And I really do feel until we as a country deal with the fact that these are institutional impediments that need to be acknowledged. And then we need to figure out not just the conversation about it, but the action to right those wrongs.
Absolutely. And one of the things I'm so excited about for you personally is your new opportunity where you intend to very publicly right those wrongs. And I have to say, Star, I'm right there with you. Every one of us have a role to play in fixing these things that stand in the way of women and people of color having equal opportunity in this country. So you are going to lead the way with your new business empire. Why don't you tell us about what you are up to now?
I'm so excited about this. This really gives me the opportunity to shine a light in a way that has never really happened. The world knows Marquee Who's Who. These are the periodicals that tell you mattered in the United States of America. And now it's Who's Who across the world. For the first time, Who's Who has tapped a woman of color to be the CEO. Erica Lee is indeed the CEO of Who's Who, and the publisher and the CEO have selected me to be executive editor of the Marquee Makers List.
I love it.
Every month, the Makers List are going to present the list of those people who are impacting our world in a variety of ways. In February, the Makers List was in honor of Black History Month. So there were African Americans who are the, quote, catalysts of change. In March, because it's Women's History Month, the March List are the luminaries of the women in our country. I am so looking forward to doing this every month and introducing a whole new crop of people. What makes me really excited about it, Nancy, is the manner in which we are doing the criteria for the first time, seated at the table of the selection committee, because that's what's important, are people of a variety of backgrounds. And diversity is not just about race or gender. It's about making sure the LGBTQ plus community is indeed invited to the table. It's about making sure veterans are sitting at the table. It's about making sure that those who are differently abled or disabled are sitting at the table. Plus the races, Blacks and Asians and Latin X people are sitting at the table. And of course, the largest diverse group, which is women and men. And we put those people at the table of influence, the table of decision. And I get to set the criteria. And that criteria is completely objective, based solely on the merit of who you are and what you've achieved.
Oh, we're so excited for you. And I know we will see a whole different type of list than we've ever seen before, because I know your commitment to the broad scale diversity and inclusion. If we're honest, though, some days it's really hard to get up. You know, we all experience self-doubt. Now, I wouldn't think by talking to you right here and knowing you as well as I do that you ever would experience self-doubt, but you were really honest to talk about a time when you did. Does that ever happen to you now? And if so, what do you do about it? How do you handle it?
You know, I give myself permission to feel down, but you get one day. Yeah. I don't give myself more than a day. You get a day to feel down, then it's time to get your butt up.
Yeah.
Because I then think about everything that has happened before me. I think about my ancestors. I think about my late mother and my late grandmother, who was actually arrested at the North Carolina lunch counter during the student protests of the civil rights era. I think about men and women who die in police custody. I think about all of the things that impact on women and people of color across our nation. And then I say to myself, whatever's going on with you can't even come close. So
absolutely,
the sun comes out every single day.
Yes, it does, ma'am.
Every single day. And I know it does.
What a great perspective to have. And I know we talked a little bit about other ways you take self-care, like going to the spa, but I know you are very committed to your fitness regimen.
I know as national volunteer for AHA that stress and lack of sleep are very, very important as it relates to cardiovascular disease. And so I am working hard to put those things on the front burner for myself, the same way that I have done with fitness and with my eating regimen. Yeah. So that's my goal right now.
I love it. And that is a whole package of self-care. Good for you, man. You are the model. Thank you so much for sharing that. You know, as a lawyer, you have negotiating skills unlike any that I have seen. But when is the last time you negotiated for yourself?
I have to think that, you know, professionally, I negotiate on a regular basis whenever I'm creating new projects. And I like to encourage women to, you know, step into their space for negotiations, not to be intimidated by what somebody else has done before, to know their own value. But, you know, we as working moms, we negotiate with our kids all the time.
Mm-hmm.
If you do this, I'll do that. Mm-hmm. That's something that I have learned quite recently, that's something that you have to do. But also, you know, in relationships, you negotiate with my husband. Okay, honey, if you'll take the laundry out of the dryer and fold it, then I'll make your lunch today.
Yes.
Even
that sounds like my household. That's the kind of deals we make in my house. Gary and I make.
Though between the two of us, we would have made the lunch anyway, because we don't want them in our kitchen, and we'll just go ahead and figure it out.
Exactly. Okay, so we had a fun little video of your entire life flashing in front of your eyes and mine.
This is your life.
I love it. That kicked us off. You know, and I don't think a lot of people know or remember, how did you go from being an attorney in New York City, dealing with homicides and other kinds of things, to getting on TV? Like, how did that happen? What happened?
You know, it's so funny. I asked that question so often, even after all these years. And I always just say I traded in one jury for another. I remember, you know, I was a young prosecutor. I was in my late 20s, in like 1989, 1990. And I had been elevated to senior assistant district attorney by 1990. And so I didn't have as much of a caseload as some of the junior assistants because I really was doing very, very serious cases or high profile cases. And we were in something called the trial cadre, which is where all the fancy schmancy prosecutors, we were like our own little law firm in there for whatever the high profile cases were. And one of my partners was this brilliant female attorney, Suzanne Mondo. And one day she got a phone call from her husband, our former colleague, Bruce. And Bruce called her to say that he had a new client. He was now in private practice, and his new client was an entity called Court TV, and they were going to launch in the next couple of weeks, and they wanted to bring on a prosecutor to do commentary. That's the way he described it. And she said, "What do you mean commentary?" He said, "Yeah, think about it like Madden, but for trials. They're just gonna, you do a play-by-play." And this is 1991, this conversation. He said, "You just got to do play-by-play. They'll have like a defense attorney. They'll have a law professor. So Suzanne, will you do it?" So he's asking her, and I will remember forever Suzanne's response was, "I am not that vain. Ask Star."
And you didn't take any offense to that.
Very
That's a
clearly, I was that vain. So we had those phones where we actually shared a phone in the center of two desks that were butted up against each other. And so she turned the phone around, and I, instead of finishing it on speaker, I don't know what made me do this, but I put it to my ear. I saw it as an opportunity immediately.
Yeah.
So I said to him, "Okay, what do they need me to do?" They said, "Well, you'll come in and you'll see the video of some part of a trial, and then you will give your opinion on it. And it'll just be you and a defense attorney and a law professor, and just the three of you all will talk like a
please
panel."
don't let her
"Okay, no
answer
problem."
that question.
And then they said something that really just sent me over the edge. He said, "And we'll send a car for you." I was like, "What?" Showed up at the studio, and when I walked in, I was floored because the defense attorney that I was going to be sitting with was F. Lee Bailey, and the law professor was Arthur Miller from Harvard. So I said, "Oh," they forgot to tell me that these are two of the most brilliant legal minds in our country. And instead, it's 1991, I was 29. And instead of getting too scared or too intimidated, I took my seat. And the Today Show producer, James Blue, he was actually a booker, saw me and took the tape to then Jeff Zucker. Jeff Zucker was the head of the Today Show, and said, this is somebody very different than we use as a legal commentator. And Jeff Zucker said, "Bring her on." And so in October 1991, I did my very first Today Show, and Katie Couric interviewed me, and Katie Couric introduced me by saying, "And joining us next is Star Jones from Brooklyn, reputed to be one of the best trial attorneys in all of New York." And my mother said I looked like I was about to burst out laughing. So as you can see, that was a little bit different than the way, say, Arthur Miller might do commentary. And that my career took off from there. Within 6 weeks of my first appearance on the Today Show, they offered me the position of chief legal correspondent for NBC News.
And that was a moment to cheer for. And, although I didn't know you back then, I remember as clear as a day the reporting you did on the O.J. Simpson trial. Every night my mother and I lived in Michigan, so did she, but not close to each other. We would call each other every night to recap the trial. And she would always say, "Well, here's what Star Jones had to say." So there you go. Now, Star, I want to switch topics to something that I know is really important to you. And that is the incredible, wonderful family you have. And I have never seen you happier in all the years I've known you than on the day that you and Ricardo joined hands. And I will always remember how you beamed and how he beamed, and the wonderful stepson that you have. And so love means everything, and at this point in your life, you have this incredible family. What has that done to you to change who you are, or to enhance who you are, maybe is a better way to say it?
It really has enhanced me. I think women all over the world are always talking about this quote work-life balance, and I don't believe in work-life balance. I don't think you're ever going to balance. I was looking for work-life integration, and I really and truly found it. Ricardo is just the kindest human being that I have ever known.
He
Really
is so
and truly is. And I remember when we were first dating, and I would say to my mom, he's just so nice. He's so sweet to me. He's kind and gentle and generous. And at one point she said, "Stop it. You act like you don't deserve that. You deserve it all. Yeah. You deserve a man who's like that." And you know what? I do.
Absolutely.
Every woman does.
Yeah.
And I can tell you, he really is wonderful. And then he brought the most wonderful child to the marriage. I met Jake within the first month of Ricardo and I starting to date, and we fell in love with each other. We laugh about the fact that at 10 years old, he didn't even come up to my shoulder. And now my 15-year-old son is 6'3".
Oh, I love
and
it.
the most wonderfully handsome, debonair young man who is just equally kind as his father. They are the loves of my life. And, the global pandemic, one thing it did, it really showed me that I made the right choice. Ricardo and I fell more in love during this time
I love
because
that.
for 3 straight months, we were with each other and no one else. And Jake and Ricardo and I grew as a family during this time, and we played cards together and board games, and we just fell more and more and more in love with each other. And so we took this as an opportunity to just grow our family. And I think that that's something that has just been a tremendous blessing in my life. I just could not ask for anything more. I have known love now. I think of Tina Turner's song, "I Want to Know What Love Is."
Yeah.
And I can tell you right now, I know what it is.
And I love your wonderful family. So speaking of Jake, if you had just one piece of advice that you could give him for his life, what would it be?
The advice that actually Oprah Winfrey gave to me, stand in the space that God had created for you. Don't be afraid to take your rightful place. This is your time. This is your space. Go for it, baby. Go for it.
And we've talked about your mother and grandmother, and maybe one of them are the individuals who's given you the best advice you've ever been given. I feel like today we have gotten to know each other a little bit better, although, again, you are one of my closest friends. I am so grateful to you for kicking off my new show. I thank you for everything, most of all for your love and your friendship. But I just want to ask you to end by saying, if you had one word of wisdom for our viewers, what would it be?
Be the author of the only dictionary that defines you. That would be my advice. Actually, be the author and the editor, because it will change. Your dictionary definition of yourself. You may think of yourself as that lawyer at 8 years old. But as you grow as a human being, make sure there's room for other branches. I never knew that I wanted to be a wife and a mother the way I do. Those are beautiful new branches that have grown into my life. And so although I am the author of that dictionary that defines me, I got to be the editor. I got to say, you know what, I'm going to make a little bit of an adjustment because it's going to enhance my life. Don't be afraid to adjust. Look at every opportunity as a new moment to grow. I believe in continuing learning all throughout my life. The moment I stop learning is the moment that I know that life is over for me. I want to learn something new every single day. And I want to wake up in the morning and know that I'm going to leave this earth better today than I found it yesterday.
Now, that is a good set of advice for all of us. Star Jones, thank you for this time together. I know that we went a little longer than we had intended, but I am so glad we did. I cannot wait till we are together face to face again. Thank you. Please give my love to Ricardo and Jake and Mimi, and we will see you soon.
We certainly will. Thank you so much, Nancy.
Okay, bye, Star. I want to thank Star Jones for her time, for her voice, and for her amazing perspectives. I learned so much from her, and I think for all of us, there's a lot to think about that we can turn into action. Star's light shines as she continues to choose to challenge the status quo as she pushes for equality on all fronts. Star, thank you for joining us for this important conversation. And I just have to say, the one thing that stood out most to me of many things that I learned from you today was when you were told by a guidance counselor at school not to rock the boat, and you went home and your mother said, "Girl, you turn that boat over." And knowing you as I do, I know that's how you live your life. I would love to hear from all of you about what impacted you. What stood out for you today from today's show? Let's hear from you about that. Thank you for joining me for Women's Month and the International Day of the Woman. This is only the beginning. Stay tuned to find out which remarkable person I will bring to you next.
On the next, At the Heart of It with Nancy Brown. Going viral for change. JT Laybourne shares his heart and life-changing journey. Plus, see how he used social media platform TikTok to raise more than $700,000 for the American Heart Association. Hear his heartfelt and emotional story. See how you can spread joy and maybe even go viral the JT way. His conversation with Nancy is one you don't want to miss. Next, At the Heart of It.
Most of us have a favorite song or soundtrack as motivation when we need it most. No matter which beat we choose, music inspires us all. Tuning into ourselves with mellow musical interludes, remixing our routines to push a little harder, grooving on healthier meal choices, even staying on beat with our blood pressure numbers and CPR training. Join us and get moving today for a healthier tomorrow.
Welcome to Beauty Superstars Talk, your backstage pass to experts in beauty. My name is Mickey Wright, and each and every week I have the privilege to interview Black beauty bosses who are doing amazing things in the beauty industry. We give voice to their stories and celebrate their excellence while they drop nuggets to help all of us become better beauty pros and better entrepreneurs. More than a podcast, this is a movement to encourage Black excellence, entrepreneurship, to preserve our history, and to bring healing to the beauty industry.